welcome to the Vigilante Dialogues. I am your host, Shaina Smith, and as always, welcoming everyone to the National Boardroom. If this is your first time tuning into the program, the objective of our program is to talk about community affairs and issues and not just complain about the problems, but to look at solutions. The last time we were here in the boardroom, we had the Chief Environmental Health Officer, Mr. Cline Smith, and we'd like to thank him for the valuable information that he shared with us concerning environmental health and the Environmental Health Division and the important work that they do. We would like now to take a break and give a word from our sponsors, Clover's Shoe Store and Smith & Associates, and we'll be right back with our next conversation. Welcome back to the Vigilante Dialogues. I am your host, Shaina Smith, welcoming everyone to our next conversation. This evening, I have guests with us from the BVI Health Services Authority, and they'll be talking about health services here in the BVI. And I must say, in my research, as far as what we have, and for the authority, it was formed in 2005, that we have some very good health services despite the complaints. So tonight we're gonna set the record straight, and we have the people here. So put your phones on speed dial, call us in at the studio 494-7815 with any questions or comments that you may have. So my guest this evening is Bishop John Cline, who is the new chairman of the board. Welcome.
Good to be here.
And Ms. Pat Malone-Smith, who is the director of hospital services. Welcome.
Thank you for having us.
Okay. So according to the notes that I got, the Health Services Authority was formed in 2005. Basically, legislation was passed in March 2004 that created it. So, we were just saying this is one of the newest of the statutory bodies that has come into existence. And it was a merger between the Community Health Services Department and the Hospital Services Department, which were previously under the Ministry of Health and Social Development, correct?
Correct.
Okay. So starting with the chairman, what is the vision of the Health Services Authority?
Well, our vision is to provide quality health care. Mm-hmm. It is also to be the preferred healthcare provider in the region, not just in the BVI, mm-hmm. but we will work towards developing healthcare to the point where others seek us out instead of we seeking them out.
Okay.
So we have a great task ahead of us.
Very much so.
But it's very possible, and we will head for it.
Okay. And you took up your current position, I believe it was earlier this year.
Yes, earlier this year.
Okay, and the new board has a 2-year term, correct?
Yes.
Okay. All right. So what is the vision? That was a vision. In terms of the mission now, what are some of the goals, I should say, as far as what the authority wants to accomplish? You talked about a regional mandate now, and I think that's probably the first time our viewers are hearing in terms of that big a scope. So
well, it's a big scope, but of course we have to take some steps to get there. Mm-hmm. And what our mission is at home, first of all, is that we care for everyone that comes into our facility and give them the best possible care, and treat them with professionalism, treat them with respect, treat them like they were our very own mothers that we were taking care of. And our mission is to just do that in the most excellent of way.
Okay. So I know a lot of times people make the assumption when we hear the Health Services Authority, they just think about the hospital. But Ms. Malone-Smith, could you explain some of the other services that the authority is responsible for?
As the BVI Health Services Authority, yes, they think about the hospital first, but we also have the clinics. Mm-hmm. We have a dental unit and a mental health unit. We have 9 clinics because there's clinics in every district. Mm-hmm. And the clinics are set up to be the place where you go for your regular care, mm-hmm. and preventative care.
Okay.
The hospital is set up to be for acute care setting. Your acute care setting if you're acutely ill. Mental health is just that, mm-hmm. your mental well-being, mm-hmm. and dental is for your dental care. So we are well-rounded, and we offer every aspect of healthcare across the spectrum.
Yeah, because I was impressed when I started looking through the charter as far as things like elderly care, family planning, health promotion, wellness, immunization, occupational health. Some of the support services in a hospital are the CT scan, the dialysis, and most people know about diagnostic imaging and pharmacy and so forth and so on. I was curious though, as far as as the bishop referred to, as far as being the best in the region, how do we stack up against the region right now, as far as you're aware?
Well,
Go ahead and start that answer.
well, there's no doubt that we have a long way to go. If we were at least halfway where we wanted to be, I think we would see less travel off island to the other islands, the neighboring islands like Puerto Rico or St. Thomas, and even the United States. So even though we have quite a ways to go, I think we are making great strides to get there. So I'm not sure that I would draw a comparison right now, but just to say that I believe that we are on the right track to accomplishing our mission.
Okay. And you guys sent me something called the Patient's Bill of Rights. Could you elaborate a little bit on that? Because that's something also I hadn't heard much about before.
Yes. One of the things we've talked about, we've been trying to get out to the patient, is that they have rights as patients, but they also have responsibility. They have the right when they come in, because this is the Patient Bill of Rights. And in it talks about when you come in, you can expect good care. You should expect to be treated with respect. There's certain things that you should expect, but it also talks about your responsibility. You're supposed to give us all the right information. You're supposed to let us know what's going on with you. You're supposed to pay.
Okay.
So there's rights and there's responsibilities. And one of the things I'd like for the patients who coming in to start asking for this, because it supports them and it supports us.
Okay.
In giving them the care that they need.
So that is sort of then like a partnership now between you, the service provider, as well as and the client, in terms of getting the best experience now when they go and get health services at any facility, not just the hospital.
Not just the hospital.
Okay.
It's across the board for us.
Okay.
Whether you go to mental health, dental health, or one of the community clinics, it's the same. Patients have a certain set of rights, so there are things that they can demand, but in demanding, there's some responsibilities that come with that as well. And we want to partner with you. I don't want to tell you how to take care of yourself, and you just have to wait and listen to what I have to say. I want you to start coming in saying, this is what's going on. How can you help me get to the next place of wellness?
Okay.
And if you come in, and I've always said in my practicing, an educated patient is your best patient. Because if you have the information, you do better.
Okay.
And if you use it.
If you use the information.
I'm going to do my best to give you the information that you need to make a better you.
Yeah.
My expectation after I give it to you is that you will follow through and use it.
Okay.
And if that happens, we have a partnership. And then you spend less time at the hospital in an acute setting, more times at the clinics doing preventative care and being healthy and being well.
Yeah.
And that's our goal.
Okay. All right. If you just tuned in you are tuned into the Vigilante Dialogues. I am your host, Shaina Smith, and with me this evening is the chairman of the Health Services Authority, Bishop John Cline, and Pat Malone-Smith, the director of Hospital Services. We're inviting you to join in our conversation this evening by calling 494-7815. So, Bishop Cline, you've taken
Chairman Cline.
Chairman Cline. Oh, Chairman Cline tonight.
Chairman Cline tonight.
We'll make sure we put that in the title. Chairman Cline, you've just taken over the authority, and I was reading the article that they did in the Pulse, which is their newsletter, and it was talking about some of the changes that are going to be coming on stream. So let's start talking about that. What are some of the changes that are going to be coming on stream for us to become a regional provider?
Well, changes. I think one of the things that you will find with the healthcare system and coming from a government-run institution to more a governing board institution is that some of the things that was done on the government were done and people expected healthcare to be free. One of the big changes that you will see, and we will try to get the word out to people, is healthcare in the BVI is not free. Somebody has to pay for it. And we want to communicate that message because in order to accomplish the vision set before us, in order to keep more people from having to travel to Puerto Rico, to St. Thomas, which really and truly impacts their economy in a positive way. They have more money in their pockets if they don't have to pay airfare, a taxi to and from the airport to the hotel, then a taxi to and from the hotel to the doctor, and then pay the doctor. Not to mention the time away from work or their children or family or so on. If we can make the changes that are necessary to keep people at home, it's going to take money. And one of the things that will be coming on stream, we will be billing our patients. Now, of course, we have this whole thing about who's exempt and who's not exempt. And we want to communicate to the public that as far as the BVI Health Services Authority is concerned, we have a responsibility to bill everyone. Now, who pays for that bill is the question that has to be answered. Whether it's government because they're exempt by government, so government pays us, or the insurance company pays us, or it's being paid by the individual who's being cared for, someone has to pay the bill. So
no free lunch.
There's no free lunch. So we are asking the public, and they're partnering with us to be this preferred healthcare provider, that when they show up to the hospital, to ensure they have proper ID, their insurance card, their checkbook, and the things that are necessary. I mean, I know it's going to be a change for a lot of people, but we are in the healthcare business, and you can't run a business giving away everything free. And so there are people who complain also that this is change number 2, that I come to the hospital and I don't get a bill for 3 years. Well, those days are over. Right now, most people who come to the hospital can leave with some type of bill.
Okay.
And so that's a big change we are implementing. We are not exactly where we need to be, but we can almost guarantee that when you leave the hospital, that you will have a bill. So you don't have to wait 6 months, a year, or 2 years to get a bill. And we are working diligently on fine-tuning that process. That from admission to discharge, whether it's a day or 3 days, that at the end of your stay, in short order, you will have a bill. And I think a lot of people will appreciate doing that so that they can pay their bill promptly. Those are some of the changes. There are other changes that's coming. There are other initiatives that's coming. Of course, because of the population of the BVI, we cannot have on the ground all the specialties that sometimes are needed in the healthcare system. But so what we have to do now is partner with providers in the region like Puerto Rico, and we've sought out a partner in Puerto Rico that we are accustomed of sending patients to, and they have agreed, once everything is settled and signed, to send specialists here, doctors who specialize in different areas. Ms. Malone-Smith can talk more about that. But send them here for a day or 2 or a week, and we can gather people together who they will need to see within that time. They see them, they treat them, and then leave them in care of their primary physician here on the island. And I think that also is one of the major changes that we're working on in order to, on our way to becoming the place that people go.
So let's talk a little bit more about that, because we have been hearing in the news about the different meetings that have been occurring with HEMA Health, I believe is the name of the organization, and what it is we're trying to accomplish there.
HEMA Health has several different components of things that we might be interested in, but the one thing we're actively working on that Chairman Cline has talked about is getting the specialists on the ground, because with our population, you can't sustain some specialties over time. But we have the need.
Okay.
Urology, hematology, because we have a pretty decent sized sickling population of sicklers, so they need particular care that we can't offer on the ground like we need to. So we've talked with HEMA about sending a sickler, a hematologist once a month.
Okay.
Nephrology, because our dialysis population is out of control.
Yeah.
So we need to.
That's the one we hear most.
That's the one you hear most about. And our plan is to, because we've talked a lot about dialysis and how we keep growing the unit. And one of the things the chairman came and said, can we stop growing this unit and start figuring out how we can start shrinking it by talking about wellness and interventions? And one of the ways we can do that is by having a nephrologist on the ground. So we're going to start having renal clinics for the dialysis patients, and for people who are tilting towards, to see if we can rescue them and bring them back to the center. So.
And the figure for that per month was, I think I read, $15,000.
About $15,000 a month for dialysis care per patient.
Per patient.
Per
wow.
patient.
You know.
And that's a cost that who's paying?
Well, it depends.
You know, one of the things that the old folk used to say, I came meet the saying, so I say the old folk, is that prevention is better than cure. And if we can have the specialists telling potential, I don't know the fancy word she's using, nephrologist or something.
Nephrologist.
Yes.
Kidney doctor.
Kidney doctor. That's what I understand. Telling these people what is the cause of kidney failure, how to change their lifestyle, whether it's diet or exercise or what have you, so that they can stop going there, and those who are borderline to bring them back, then we are not just interested in taking care of the sick, but we are interested in also helping the well to stay well, and those who are borderline sick to come back to the well side. So we are not just, we just don't want to be
healthcare business.
But we want to be in the healthcare business, not in the sick care business.
Not the sick care, all right.
Yes.
So that's the difference.
Yes.
Okay, and I think that is key, because I had, who was it? I think Miss George, Ivy George, talking about chronic diseases that we have. And, you know, the underlying theme that she left with us was that a lot of this stuff is preventable.
Yes.
We're at risk sometimes because of genetics and environment, but a lot of it is the choices we make, whether it's food we eat or whatever we put in our body, you know, that basically over time eventually has a negative impact and has us having to do things like, you know, dialysis. And from what I read, it's like dialysis is no walk in the park, because it's like 4 hours that you're on the machine.
Most patients are on the machine 4 hours a day, 3 days a week.
Wow.
3 days a week.
So that takes a big chunk out of it. And then before you get on the machine, you may not feel well because you accumulated the toxins.
Yeah.
And then you get off the machine. It takes a little bit of time to recover because of the whole
procedure.
And what happens to get you to the place where your blood is clear.
Okay, we went down a little rabbit hole there, but it's
Sorry.
okay. Okay, so we stopped at the kidney doctor. Any other specialists that we're looking at?
Ear, nose, and throat.
Okay.
We're looking towards cardiology. That's where we're starting. But one of the things that I find interesting, because I've been talking to the HEMA people, is the doctors at HEMA have gotten wind of the ones that are coming. So other specialties that we didn't even ask for yet,
They're looking into coming too.
Can we come too? And we're like, hold on, let's just get this stuff started and get a plan going and get our clinics set up, our specialist clinics set up, and then we can see if we can accommodate these other specialties that we haven't even asked for yet, that are now trying to knock the door down, trying to come as well.
Okay.
But I think that is great that we have doctors who
showing that
want
interest
to come.
here. Yeah. And I think too, it's, you know, people probably take for granted the amount of healthcare that people procure overseas. because we go to everything from, you know, an allergist, orthopedic surgeons. I mean, it's like really major stuff that we have to go offshore for. So it'd be great if, you know, I can just get in the car and drive up the road.
That's all right.
and have those services here, basically on my home turf. Okay, so that's a relationship. Anything else with HEMA besides the specialist care that we're looking at, as far as the initial relationship that we're trying to build with them?
I would say, of course, they do some things well in terms of processes. What is the process when a patient is admitted? What happens when medical supplies or medication is used to that patient? How is it captured? How is it billed? How is it recorded to that patient file? Those kind of things that they do well that we still do manually. We are looking to fine-tune the process to the point where we can do it electronically with our health information systems that we hope to install within the next 12 months, get it up and running. So those things will help us to be more efficient, more effective in care. So I think there's a lot for the people of this territory to look forward to in terms of healthcare. So those are the kind of things we're going to draw from the people who have done it, who know how to do it instead of us trying to reinvent the wheel or try to build a car ourselves. There are people who have done it and they do it every day, they do it well, and we will draw from their strengths.
Okay. All right, you're tuned in to the Vigilante Dialogues. I am your host, Shaina Smith. We're going to take a quick commercial break, a word from our sponsors, Clover's Shoe Store, and be right back to learn more about BVI Health Services Authority. Welcome back to the Vigilante Dialogues. I am your host, Shaina Smith, and with me this evening, my guests in the boardroom are Chairman Bishop. Chairman John Cline of the BVI Health Services Authority Board and Mrs. Pat Malone-Smith, Director of Hospital Services. Okay, let's talk some more about what's happening in the hospital, because even in the past, I would say probably 12 months, we've seen a lot of things changing as far as how persons access care and some other things. But let me just ask the chairman, in terms of changes that you want to see over your tenure, is there anything else that you want to let the public know about at this point? And also, why are they necessary and the benefits to the community?
Well, everything ties back to the vision. If we're going to be preferred, then there are things we must do. One of the top priorities is to install a health information management system. And with that, we can better track patient care. A patient will be given a patient ID. So whether you're in King Garden Bay Clinic or whether you're in Rotown Clinic or whether you're in People's Hospital, that ID remains the same. We know what medication you have been given in King Garden Bay versus Rotown, or what happened to you last year, who was your doctor, and all those kind of things are vital to managing the system.
So it'll be basically, it will connect the network.
Absolutely. We are also looking further down the road, because we have these outer islands like Just Van Dyke and Virgin Gorda. Not Virgin Gorda so much, because we do plan to have a more substantial healthcare presence in Virgin Gorda, but Anegada. We're looking at telemedicine, how we can have a specialist in BVI, let's say, look at someone in Anegada with health practitioners and without making necessarily the long trip, and those kind of things can be done. They're being done around the world.
So basically over the phone?
Well, not only over the phone. There are phones, there are cameras.
Video conference.
Video conferences, diagnostics tools on the other end, and someone who is equipped to follow the directions of the doctors. Yes. So, all of those things are changes. And the benefits all tie in to cost savings on one hand, better care on the other hand, and providing extensive care and services. So I think when it all comes together, you know, I would rather be in BVI, being cared for here, than to have to spend a day or two in Puerto Rico in hotels and stuff. I would rather be here.
I'm glad you said that, because then I'm gonna ask the question that I know somebody who should be calling in. The number is 494-7815. You know, I remember having a conversation, it was a few years back, about People's Hospital. And people saying, if I ever get sick, I do not want them to take me to People's. I would rather stay home and wait till the next day to catch a flight or a boat. What is the, you know, how do you guys view that? Because I know a lot of times we tend to only hear about the bad stuff. And I know from now being there a few months working on the project, that place is very, very busy. You know, and a lot of it doesn't even go near the news media. So, Pat, how do you view that, and how would you counter that as far as what happens at the hospital and the care and the level of care that we receive there?
For the person that said that, it's usually not somebody who's had direct care at People's. It's usually somebody who they knew, who knew somebody who knew somebody.
Who had an experience.
Who had an experience. And I'm not going to deny that some things may have happened in the past, because in every hospital you have things that happen. But the truth of the matter is, we give excellent care at People's. We stabilize patients that once we get them transferred to a higher level of care, sometimes they are surprised that they even lasted to get to that higher level of care.
Okay.
And because you can't transfer unless you're stable. Okay? So in order to even get you to the place where, for the care that we cannot provide, you have to get stable. So the people on the ground have got to be good at what they do. We provide very good care, but we don't hear about the good care. Usually once the family member is so happy that the patient is well taken care of and they're on their road to recovery and rah. So, and they leave. The person that we hear about is the person, their family member did okay, but maybe we didn't speak to them in the emergency room while they were waiting like we should have. Those kind of things are the things that we're working on. Communication with the patient supports, family support while the patient is being cared for. I think sometimes we focus on the patient so much, and the people in the waiting room get left out and they don't know what's going on. So we started working on those kind of things. And it's as simple as coming on and saying, we're taking care of your loved one. As soon as you can see this person, we'll let you in. We are getting better at that, but there have been times when to our detriment, we haven't had the conversation like we need to. And if I don't have any information, I'm going to create some. I say, well, this must be going on because nobody's saying anything to me. So,
and you're already anxious because, you know, you're in there because of an emergency situation, and then if you're not hearing anything from the people, or they don't seem to be moving as fast as you would appreciate.
And in some instances, we're moving, but we haven't explained why we're moving in this manner. So that's the one thing we have to actively work on, and we acknowledge that. We acknowledge that communication with the people in the waiting area is something we need to step up. But as late as the recent emergency that came from VG, we were on top of our game with that. Based on what I know happened and what could have happened.
Kudos. So we do have, I would say, a very better than good system. I think a lot of people take that for granted, because I go overseas. Sometimes we go overseas for care, but we never come back and talk about how dissatisfied we are either. Because a lot of times we go to doctors in St. Thomas or Puerto Rico and we're not happy, so we end up right back home and have to go through.
There was a time when sick people believed that God lived in Puerto Rico, and then after a while he moved to Miami. So, and then because they found out that people die in Puerto Rico also, so God must have moved. And we, you know, people have to be real. We all have to be real. People will die. I mean,
regardless of how good the doctors are.
Regardless of how good the doctors are, people die everywhere, all over the world, because that's the way God set it up. that we ain't here to stay.
To live forever.
We gonna die. The thing that we are concerned with that is that we don't help you to die unnecessarily. And so we will do whatever we can to provide the best health care. So I am not only asking the public. On the inside, we're going to stay on top of doctors, to be respectful, to be to be concerned, show compassion to the person, but also the families that are waiting. Don't just, be so caught up in what you're doing that you don't understand that people want to know, or at least have a nurse say something to them. And we're going to hold people responsible for their behaviors. And I think in the past, sometimes that has not been done, but it is going to be part of our mission that we hold doctors accountable for treating patients with the best care possible.
Okay.
And those are some of the things we will do.
That's good news. One other change that we've been hearing about in the news that we haven't touched on, and I just want to clarify, you guys to clarify a bit about what's happening in that regard, which is the Chief Executive Officer. We know that you are in the process, I believe, of selecting one, but some people may not be clear as far as how that is going to happen, and when do we expect to probably hear about that new management position being filled.
Well, we had, the acting CEO who was there for how many years?
About 4.
About 4 years, asked to be released of his duties and go back to the ministry. It was his decision that he asked to no longer serve as CEO. It wasn't anyone's decision to remove him. It was his decision, and we complied with that decision, both us and the ministry. In terms of the CEO position, it is important for the public to understand that the board recommends to the ministry, who then takes the cabinet for approval. So it's not the chairman's decision alone. The board meet, we decide, we examine candidates based on their qualifications. Then we send a recommendation to the ministry, as we have found in our interviews, and then that goes to cabinet for approval. So, sometimes you read stuff and bloggers out there and they're talking stuff they don't know nothing about, but they still getting on the computer just typing nonsense. And, not knowing that it's a process, and there's checks and balances. There's not a one-man show. These are a group of people that we give of our time almost voluntarily. It's not like we sit and getting any big salary. The government asks us to serve and give of our time, for just about little or nothing. Could hardly buy lunch.
You get lunch.
But we do it because we love our country, and we spend a lot of time to put in strategic plans. And part of that is selecting key position to submit to the cabinet for approval.
Okay.
So we will soon have a replacement for the CEO that just left. Hopefully, we have sent the request forward to the ministry, who will take it to cabinet for approval, and hopefully we are back on track.
Okay. All right. If you just tuned in, you're tuned into the Vigilante Dialogues. I am your host, Shaina Smith, and with me tonight in the boardroom is Chairman John Cline of the Health Services Authority Board, and Pat Malone-Smith, the Director of Hospital Services, and we're talking about healthcare and the Health Services Authority. So we've talked about the changes that we want to see in the mandate of being the preferred regional provider. I like that, I like us being ambitious. We shoot for the moon and we hit the stars. Some of the other things I'd like us to touch on in terms of how does a person access services that the health services. We talked in the beginning initially about the gamut of services that are actually available to the public healthcare system. In other countries, a lot of that is provided privately. So I think we're in a very blessed situation in terms of being able to go to an audiologist, in terms of hearing and other different things. But how would someone access services, whether it's in the districts or at the clinics or at the hospital?
For the clinics in the district, there's appointment. You can call the different clinics and set up appointments for to see the doctor. One of the things we've been doing is like we now have the specialist physicians traveling to the clinics on certain days. Okay. So if you need to see the pediatrician, you don't just have to come to the hospital anymore. The pediatrician goes to Road Town. They spend a day in Virgin Gorda. So your job as the client seeking help is to call and find out when the specialist is going to be there, if you want to see the specialist in particular. Okay. But there's a physician at the clinics at certain days of the week, every day of the week. You call, you make your appointments, you go in. Hospital is a little bit different. You access care in an acute manner. So you come in via the emergency room because you have an issue. You present at the emergency room. They do the initial assessment. If you're really sick, you may end up having to be admitted. Okay. Or you can be treated and then discharged with a referral to see a specialist. Okay. And then you make an appointment to see that specialist because at the hospital, there's specialist clinics. Okay. Okay. That's where the internal medicine physician, the pediatricians, the obstetricians, and the surgeons, and the orthopod, because we now have an orthopedic surgeon on the ground. And that's who? His name is Dr. Shoaib.
And what area of specialty am I in? That's a foot doctor?
Orthopedic surgeon. No.
What's that?
He does pods.
Oh, bones. Okay. Oh, the podiatrist. Show off.
He does bones.
Podiatrist is what I'm thinking of.
We do have a podiatrist that comes once a month, but he's actually a podiatrist and a foot and ankle surgeon.
Okay.
He does.
That's the foot doctor.
Yes, he does big business for us.
Okay. We're not taking care of our feet?
We're not taking care of our feet. We're not taking care of our calf area, so he does a lot of vein stuff. He does wound care. Okay. So usually, as soon as we announce that he's on his way, the clinic
appointment books fill up
full.
Okay.
To the point of almost double booking.
So this space that just recently opened up, what is that for?
That's for the specialist clinics.
Okay.
Can I tell you, Dr. Samuel and I are so happy. We've been asking for that space for feels like forever.
And let me take a little time to give like kudos to the Minister of Health, who is very ambitious, who's on board with us, who provide the finances that we need to move things forward. He's a man of action and decision, and if there's a good idea out there that he knows that will move healthcare forward, he's going to embrace it, and we're going to run with it. And that's the kind of action we need, because I feel like we've been 7 years in the wilderness since 2005 to 2012. If we go to the biblical numerology, that's 7 years of lean. I think we are heading into 7 years of fat, and of plenty. And this 8th year of the authority's existence, I believe, is truly a new beginning for great healthcare in the BVI.
I would hope so, because I want to just drive to the hospital.
So we've gone from a 2-unit specialist clinic to now we have 4 units.
Okay.
Four rooms, four consultation rooms. We're in the process of expanding our fast track as well.
Okay.
And let me explain what the fast track is. The fast track is for the patient who comes to the emergency room with that cold that they had for a week and a half and never made it to the clinic for. So they decided, I'm going to go to the emergency room and get this thing taken care of once and for all. And they run up in the emergency room, and then they have to sit for 4 hours because they've had to go for an hour and a half because I came in with shortness of breath. He came in with a laceration that was bleeding. He came after them. But they're more acute and they're emergency. They're an emergency. You weren't. Yeah. So what we decided for those patients we're going to create a special area just for them. Okay. And set aside a physician just to take care of them. Okay. And expedite their process to the emergency room. So you present, you get triaged. If you're sick and you need to be seen by the doctors because you have the shortness of breath, the potential heart attack, the stroke, you go up to the right side of the building to the emergency room. Fast track is to our left, and in that area, you're seen by the doctor, you're assessed, If you need to have some lab work or anything done, she writes for that. She sends you to get it. You
Okay.
get it done and you leave. Fast track is like a glorified clinic.
I was about to ask about that because I know persons have talked about after hours. So, okay, maybe I didn't go and take care of it when it was during the day, regular hours. But in terms of after hours, like, you know, some people work till 6 o'clock. And, you know, so they would only be available to go to the doctor after
Yes,
those times.
and we noticed that our ER gets busy.
Yeah,
After
after hours,
5.
yeah.
So the fast track, one of our plans for the fast track and moving it over into that new area is it's going to be open until 10
Okay.
to accommodate those patients, those people who went to work and have had that cold for a week.
Or
Yes,
went
I,
home
mean,
and
I
find-
couldn't get
Yeah.
to the hospital.
Yeah, or even going up and find their child, you know, with a high fever or a fever, they want to bring him.
And just bring
You
them
know,
in.
because and that's a distinction we want to make. We want to make and help the public to understand there's a difference between an emergency
And urgent care.
and urgent care.
There you
That's
go.
what it is.
So so that if someone is sitting there for 3 hours and someone comes in with a lacerate, you know, cut
Yeah,
over
once
the head or something
the
like that,
ambulance pulls up, I'm like
we have
last
to
on the
move
list.
them in.
Yes.
So,
You
but
become last on the list. I got it.
they're no less important, but emergency is an emergency. So to help fine-tune the process
Okay.
and still give you the care you need, then there's this fast track,
Okay.
and those are some of the changes.
Okay.
And it seems to be working.
Okay. So that is in place.
That
now.
is the fast track is in place. Our hours have been extended, so we're about to extend our hours. We're trying to work on a physician
Okay.
for that-
To cover that
to
shift.
cover that extra shift. Yes.
Okay.
Because right now the fast track is open from 9 to 5,
Okay.
and we want to take it to like 10 at night.
Okay. And then hopefully, you know, the public will know when that is.
Right.
Okay.
Well, our goal is to educate the public in forums like this about what's now going on. Because I think a lot of what happens is the folks don't know what we're doing. We haven't told them. We just do it.
So we don't know what to expect. So I go and I expect because I came in before the ambulance, I am going to be tended to.
Exactly, because I got here first.
Yes.
Yeah, it doesn't quite work like that in the ER.
All right. That is good information to know. That is very good to know. Tell me something. I noticed the other day I was visiting some family in the hospital, and you have visitor cards now. What exactly is that about, and how does that work?
First of all, let's talk about the fact that we've changed visiting hours.
Okay.
And folks didn't know that. Visiting hours used to be 11 to 12 and 4 to 6.
Yeah.
We decided we're going to be fabulous and change them to 11 to 8.
11 to 8.
Yes.
11 a.m. to 8 p.m.
Yes.
Okay.
So visiting hours are from 11 a.m. to 8 p.m. I would like for people to understand that we would like to have 2 visitors at the bedside at a time
Okay.
and not the whole block at a time.
Yes. Yes. We're concerned.
So I understand concern. So one of the things we did to help that is we set up some visitors cards, and each bed has 2 visitors passes assigned to it.
Okay.
When you present to the hospital, our security guard, please treat them nicely. They ask you to sign into the book.
They get a lot of abuse, I know.
They asked you to sign into the book. We asked for ID initially, and that took us down the wrong road. So now we're asking for you to at least just show the ID. So we can say that you're who you say you are. At which point I give you a pass, which gives you the right to go and see your loved one.
Okay.
You go, you see your loved one. When you come back, you hand me back my pass. You sign out and you leave. The reason for that book is twofold. We want to secure our building, so we need to know who's in the building. And in case of emergency, security guard knows that when he leaves the building, if there's a fire or anything, he's taking that book with him. I need to be able to account for who's in the building. I can account for my staff based on schedules,
Yeah.
but I cannot
Not
account for visitors
Uh-huh.
who are not in the logbook. So they're gonna tell. So some people say, the last time I saw Shaina, she was at the hospital. Well, Shaina never signed in.
Yeah.
So we're not gonna look for Shaina.
Yeah. Yeah. I get
So
left
there's-
in the fire.
Yes. So so the book is not because we're trying to mind your business or anything like that.
Yes, I want
It's
to know you in there.
It's a twofold thing. It's for safety for you, and it's safety for my staff and my patients as well.
Okay.
So that's why we ask people to sign in.
So it's very important that the public cooperates.
Please.
All right.
Not to mention, it's just good practice, you know, for us to do that, you know. keep track of who's coming in and who's going out.
Yeah.
You know, sometimes I think it's hard, it's difficult for me to say and even to admit that sometimes in the BVI we like to settle for mediocrity. We just like to settle for, you know, however you do it, and anyone try to change it, you kick against it, and you complain, and you call the minister, and you call your uncle. Come on, let's do better than that. We are better people than that. We can do better than that. Let us operate on a higher standard of a life and living, so where we can get better results.
Okay.
And I'm supporting the chairman in this, because we the same people who will go to one of the private facilities and act.
Comply.
You know, totally.
Completely.
We go to Puerto Rico. We
sit and we wait. We are saints.
It's amazing to me to see the shift that happens.
And I think it's something.
So we can behave ourselves.
Yes,
we
don't have any reason not to.
If they don't want to behave, we will force them to behave.
Well, no, we create the environment for them to conform.
Okay, I like that
That's
better.
a diplomatic way.
You sound like a diplomat.
We create the environment for them to conform.
We'll send you to the UN.
Yes, that's the plan. So let's talk about Friends of People. This is something that I've never heard about before, and then we're going to start to wrap up.
Friends of Peoples.
Who are the Friends
it's something
of
I like to talk about, but that she knows more about.
Friends of Peoples is an idea that we cannot do this by ourselves.
Okay.
We cannot manage healthcare by ourselves, and there are people out there who can help.
Okay.
Financially, however. So as we get bigger, and as we progress, we would like to start inviting the public to come alongside.
The private sector.
The private sector to come alongside and help us. So like I joke around and tell them, I said, we can name this desk the Shaina Smith desk. There's a price tag associated with that.
Okay.
But you will get your publicity.
Could be your family name donated by this family, by this corporation. It could be a piece of equipment. It could be a piece of furniture. It could be a whole room.
So how would I become
that
a
whole
friend
room.
of people then?
Well, right now, we're working on organizing the whole committee. But while that's happening, and you're feeling a pressing need.
Yes, I want to buy a bed.
You want
I want to name a bed. I can't buy a ward just yet, so I'll get a bed.
We'll take a bed right
we will,
now.
We will make sure that
I will get a tag on that bed.
Okay.
Just call, if you call
the authority office.
The authority office, the corporate office. Corporate office, and let them know who you are, and that you intend to do this. We will help you source the bed, get a quote for the bed, tell you how much it's going to cost, and then when it comes, we will have a ceremony right along with you.
Okay.
For that bed.
Okay.
And so we encourage the private sector
to come
please come alongside us.
Okay.
Because you know why it's important? We have people from all over the world here. You know, and they want to know when companies bring in their workers, whether it's from the UK or Isles of Man or Guernsey, whatever, they want to know that when they come to Peoples, they have good care.
And they
how will you have good care? One of the ways to ensure you have good care is to help us to provide good care. And whether that's donating, like as we say, a piece of equipment, we can give you an equipment list of things we need.
And this is not just this is just, we're talking about the old hospital or the new one?
This is now.
This is now.
Clinic, dental, mental health.
The whole array of services.
Yes.
Okay.
Yes.
Okay. Sounds good. All right, guys, our time has wound down on us. One last thing I wanted to touch on, and we're not going to be able to give it the time that it needs, but I know earlier this year we had quite a few doctors, local doctors that came back home and returned to service. And I want to give you a minute or two just to talk about how, because I know this is a question in terms of people looking at local doctors, even for the new hospital, but even currently to look at that. What are some of the things that you're looking at in terms of training for staff? How are we going to recruit more people locally and those types of things?
I'll let you, the director.
We look, recruiting locally is something we would love to see happen. We're doing it for like some of the ancillary staff. We've been sending people away to school in terms of like, at one point I know currently we had like 7 nursing students away.
Okay.
Our hope is that when they finish, they will come back. Because we make rooms for BVI landers when they come back. I know there are rumors, there's usually rumors out there flying that we don't hire BVI landers.
Yes.
They come back looking for jobs. And if you come back and you are qualified, you have passed your boards, and you are competent to work in the BVI, and you're a nurse, a doctor, a medical technologist, a radiographer imaging person, a medical imaging person, we will create a space for you.
Okay.
Which is what happened with our physicians that came home. It's about 5 of them that came home.
Yeah.
It's about 5 of them that came home, and everyone, when they got here, we created space for them. As nurses come home, we will create space for them because we always need nurses on the ground.
Yeah.
So when I hear people I know about 3 nurses who came home and they didn't hire them. Did they apply? Because if you apply and you're a BVI lander, our HR is very, very careful about making sure that BVI landers and belongers get first preference. We're very careful about that. So if you're a nurse and you're on the ground, and you have passed your boards, and you are competent to work, we would like to see you.
Okay. And the number at the office is?
The number to the hospital is 852-7500.
Okay.
You ask for human resources, and they will hook you up.
Okay.
We don't have a email. Yes, HR has an email address. It's HR, the HR department at bvihsa.vg.
Okay.
We have a Facebook page that our public relations person has set up, and we have gotten contacts from that from people looking for jobs.
Oh, really?
Yes.
Great. So
we have all
BVI HSA is on social media.
We sure are.
All righty.
We're doing great things.
Yeah, you are.
We're doing great things.
All right.
Like I said, that's.
But we haven't told our
Our
story.
good story don't get told. Just.
Well, I want to
the
thank you on
stories.
behalf of the BVI community for the hard work that you do. It's not an easy job, so I don't envy any of it, but it is a necessary job in terms of us having a healthy Virgin Islands. And again, it's like I was talking last week to the Chief Environmental Health Officer that we take a lot of things for granted. And the health services and the level of care that we do have, as far as the quality as well, is very well tendered, I would say. And we're looking forward to the improvements and the changes that are going to come on stream. Chairman, any closing words? You got 30 seconds.
30 seconds. We say to the people of these beautiful islands, your health is our priority, and we want to see a healthy BVI. But we must work together in order to create that environment, because the health of a nation is the wealth of a nation. So we want healthy people. Come, let's work together and do this.
Okay. Well, thank you both for being here in the National Boardroom, and we welcome you back anytime to let us know what's going on with health services and all the great positive things that are coming forward. You have been tuned in to the Vigilante Dialogues. I am your host, Shaina Smith. Dialogues is seen here on Channel 51 every Thursday at 9 p.m. and re-aired on Sundays at 6 p.m. If you would like to be a guest or sponsor, you can call us here at the studio at 494-7815. Tune in July 5th for the Next Situation Room. We've got a lot of positive feedback about our discussion on immigration, labor, and social development, and we'll be closing that out hopefully July 5th. So 9 p.m. July 5th right here on Channel 51. I'd like to thank our sponsors, Clover's Shoe Store and Smith & Associates, and I am your host, Shaina Smith, saying let's continue to change the conversation for a better Virgin Islands. Good evening.